Hi, my name is Sierra. I am the Clinical Application Analyst Trainer. Today we are going to be talking about restraint updates for providers. If you have any questions or concerns about the presentation, please feel free to contact myself or quality. Our objectives are to discuss how to update the restraint orders, how to renew restraints, and how to view face-to-face. Violent and nonviolent restraints are series orders. This means that you will be able to renew the order from the same order. ED providers can renew violent and nonviolent restraints from orders. Chemical restraints are a one-time order. The face-to-face notification will be triggered by nursing documentation of the restraints. ED providers will be notified via the ED tracker board under the face-to-face column. So first, I'll show you how to put in the orders. So I will just type out restraint, and I'll select all three: chemical restraint, nonviolent restraint, and violent restraint. First, we'll address chemical. And I do want to point out that we've adjusted the name of this order to chemical restraint with physical hold. So if the staff needs to perform a physical hold during the chemical restraint medication administration, they can do so. It's already written into the order. The chemical restraint medication, you can put in more than one if needed. And then this is the only required field here, is the violent behavior. And this answer is already defaulted so that the nursing staff will get the chemical restraint assessment. And here we can see that the medications that we selected are being reflexed to be added. And a benefit to having these chemical restraint medications reflex from this order is that when the nurses look at the MAR, that medication will say chemical restraint in the comment. If there's only one default for that medication, it'll automatically be selected. If there's more than one option, then you will need to choose. So next we'll do the nonviolent restraint. As you can see here, we have some order details. We'll go ahead and fill out all the required fields. And I'll change the time to now. And lastly, we'll do our violent restraints. Please note the different frequencies. These should be selected based on age. Since our patient is an adult, we'll use Q4. At the top, you can see the frequencies per the different age ranges. Go ahead and document our required fields. And we'll mark that to now. Review our submission and select submit. Okay, so I've put in my orders. So now I'm going to show you how to renew your orders from the orders page. So all we'll do is we'll go to the orders page. You'll find your violent or nonviolent restraint. This is a violent restraint. And you'll click under the status column on the word series. Now I have the option to renew or stop. So we'll go ahead and renew the order and select submit at the bottom. Next, I wanted to show the notification on the tracker board. So from the nursing assessment, it will populate an order to send a face-to-face reminder. That order will cause a check mark to appear under the face-to-face column, signifying to the provider that there is a face-to-face to complete. Once the provider has completed the face-to-face, to get rid of the check mark on the tracker board, they will need to complete the face-to-face order. To complete the order, go to Orders and find your face-to-face order. Under the status column, click on the word Ordered. From here, we can select Stop. You'll indicate a reason as to why you're stopping it and select OK. And we'll submit our changes. When violent or chemical restraints are initiated or renewed, a face-to-face must be performed within 1 hour, and the order must be placed within minutes. And that concludes the restraint updates for providers. Again, if you have any questions or concerns about the presentation, please reach out to Quality or I. Thank you.